Last evening, a patient was admitted to UConn Health who presented to us with very general symptoms of fever and muscle aches. This particular patient had returned from Liberia on April 30th. The patient is at very low risk for Ebola virus. In fact, he probably has another illness or infection. But out of an abundance of caution, we activated our Ebola virus disease protocol. It worked very well through the emergency department and onto our third floor isolation unit. The protocols, of course, are devised to protect both the patient and the care providers, and that's working very well. We're also working closely with the Department of Public Health in our efforts here. Testing has been sent to rule out Ebola virus disease, and we should have that testing back within 24 hours. The patient is doing well and is stable. Other illnesses are being ruled out as we speak, and I'd be happy to entertain any other questions that you might have.
When did he return?
About the patient?
I'm sorry?
Why was the patient in Liberia?
So the patient was in Liberia to help with the Ebola virus disease efforts. He was present at some Ebola virus treatment centers but did not have direct patient contact. He in fact had an administrative role, which is one of the reasons he's at very low risk for this disease.
So he's not a medical professional?
I actually don't know his exact status in that regard, but he had administrative responsibilities in Liberia.
So the person is from Connecticut?
I don't want to go into details about this. The person followed all the protocols required by the U.S. Department of Security and Homeland Security, and also with the DPH, and so was well known and being appropriately monitored and tracked by the DPH.
What organization was he working with?
I don't have that information.
Will there be anybody be quarantined as a result of this?
There are no people who are going to be quarantined as a result of this. The appropriate monitoring for his level of risk and exposure was carried out and continues to be carried out.
How long has he been, was he in Liberia, and how long has he been back in the States?
He went to Liberia in November of 2014, and he returned here on April 30th of this year. You may well know that just a few days ago, Liberia was declared Ebola-free. And so this patient returned before that declaration, and therefore, again, out of an abundance of caution, even though the risk is extremely low of him having Ebola virus disease, we are handling this as a potential possibility and doing the appropriate testing and protocols for treatment.
So he has a fever as well, is that right?
The symptoms that I can relate to you are fever and muscle aches. These are very general symptoms indicative of many diseases that are prevalent in Africa, such as malaria and others. So the likelihood is he has one of those other illnesses.
How severe is that fever?
I'll just leave the symptom description as I stated.
Did he walk in on his own? Is he a young man, middle-aged, older?
So I really, again, don't want to go into details about the patient because of privacy concerns.
Did he walk in on his own?
The patient is in good and stable condition now, and yes, he was ambulatory.
Doctor, it sounds like what you're generally saying is he's symptomatic of something, but it doesn't, to your mind, the risk is pretty low that it's Ebola, but you're still enacting your Ebola protocol.
That's a good summary of what I said.
But
Yes.
it's only the testing results at yielding